The death of James Van Der Beek is renewing national attention on colorectal cancer and the importance of early screening. The disease does not always show symptoms until it has progressed. More than 150,000 people will be diagnosed with colorectal cancer this year, and more than 50,000 are expected to die from it. Colorectal cancer is the deadliest cancer in people under the age of 50 and the second deadliest overall. Jack is sitting down with an expert on how you can protect yourself.
Thanks, Lauren. Joining me now is Dr. James Ouellette, a surgical oncologist with Premier Health. Thanks so much for joining us this afternoon. Let's start with what can cause colorectal cancer.
Well, there's a lot of risk factors, of course, since really colorectal cancer is one of the most common we see in the United States. Some of that was related to diet, genetics, so some people's genetics. And really one of the things we see is really mostly these are spontaneous, so they happen really when benign polyps really are allowed to stay in the colon and the rectum for some period of time, and then they actually become cancers.
Well, what are some of the symptoms people should look out for?
So people are seeing any rectal bleeding, sometimes there's abdominal pain, sometimes there's weight loss, though that is a little bit more of an advanced symptom. A lot of this really comes down to the best way to prevent this is with screening.
Well, Catherine O'Hara also recently died from a pulmonary embolism, which rectal cancer being the underlying cause. How could the cancer have caused that pulmonary embolism?
Great question. Cancer does a lot of things to the body. One of the things it does, it actually makes your blood a little bit more thrombogenic, meaning people get blood clots in the legs. You get the pulmonary embolus, which is a much more life-threatening and major clot that actually, whether it starts in the lung, but really a lot of times it starts in the legs or really in the pelvis, and then it actually goes to the lungs, and that's really the critical event.
Well, you know, prevention's always key. Are there ways people can cut the risk?
Absolutely. Screening in the United States is a very big factor. We put lots of different ways to do that. There are some stool tests you can get from your doctor. They look for DNA, like kind of tumor DNA. That will help direct people to get colonoscopy, which is really the gold standard for identifying, number one, a cancer, but also identifying the polyps. And then, in fact, even removing the polyps, which is key, because if you remove the polyps, then you remove that risk.
You know, people always think it's later in life, but when should people start getting screened?
So several years ago, the national screening guidelines updated from age 50, which was that for many, probably a couple of decades, to now really the general population should be screened at 45. And really, if there's a family history, certainly a close relative, really family members should be getting screened about 10 years before that person was diagnosed. And there's certainly things that put people at particular risk, and you really need to discuss that with your physician to decide how early screening should happen.
All right, sounds good. Dr. James Ouellette, surgical oncologist with Premier Health. We thank you so much for joining us this afternoon.
Thanks for having me.